My name is Catherine Namunju, and I'm going to present my project on chlorhexidine gluconate bath, also known as Chg Bath. This is my statement of authorship. Chlorhexidine gluconate bath. It's cleaning wipes or solution that kills germs and reduces the spread of infections in hospitals, especially in ICU patients and other units. The patients in ICU are very sick and they have one or more infection. Therefore, they have medical delivery equipments and tubes such as central lines, Foley catheters, feeding tubes, and these are in contact with the body's internal environment. Therefore, they easily get infections. Therefore, applying Chg Bath daily helps them to prevent infections such as central line associated bloodstream infections, also antibiotic resistant bacteria such as methicillin resistant staphylococcus aureus or MRSA, fungomycin resistant, and surgical site infections. And this is from Michigan Medicine 2017. Project design and implementation. The project took 50 hours and it ran from January 24th to February 19th. The target audience was intermediate care unit nurses and care partners on the unit who carry out the Chg Bath for the patients. I formulated a lesson plan to help in the training and conducted the in-service training on the Chg Bath. For the evaluation, I used a pre and a post-training test quiz and a survey questionnaire. Also, the tracking sheet was helpful for the patients who are receiving the Chg Bath so that I monitor the compliance. For the analysis of the questionnaire, I use the survey Mangi. The results. The total number of staff who participated were 23 in total, and those were 15 nurses and 8 care partners. The pre-intervention status of compliance was 42%, and after the intervention, it rose to 97%. The correct usage of Chg Bath wipes improved from 50% to 100%. 100% of staff were able to identify the barriers that were hindering them from having 100% compliance with the Chg Bath. That was impressive. And also 100% were able to use the most applicable strategies to improve on the compliance of Chg Bath. 100% of nurses acknowledged that the training was helpful to them. Discussion. I used the pie chart, the bar graph, and this bar graph shows the relationship between knowledge acquisition and compliance of Chg Bath. This one shows that as the compliance increased with the increase in the knowledge of the staff, and that was through the training I conducted. This pie chart is showing compliance versus non-compliance, and the compliance rose from 42 to 97%, while the non-compliance was 3%, which sure that with continuous education and training, we will reach at 100% compliance. In conclusion, the in-service training positively impacted the implementation and compliance of Chg Bath. This is because the patient outcomes improved and the hospital-acquired infections were prevented, and these shortened the length of stay for the patients. Because if they get another infection in the hospital, they stay longer because now they have more infections to deal with. Therefore, I would recommend that continuous education and monitoring be done to ensure compliance of Chg Bath. This is a list of references from where I was able to get the information. And that is Michigan and the others. Thank you.